Well, we want to talk about COVID, and for that, we're going to bring in Suzanne Judd, Ph.D. She's an epidemiologist at the University of Alabama at Birmingham School of Public Health. I want to begin with the CDC guidance that we got out regarding students returning to school in the fall. The CDC says that fully vaccinated students don't have to wear masks. Some schools have already lifted that requirement. What's your take on this latest guidance from the CDC?
I think it's the right choice. If we look at the data, we know that once folks have been vaccinated, there's less of a risk of them spreading COVID. So if we just look at the data, it's the right choice, and it helps to give the public confidence that we're using data to make decisions.
So when you take a look also at the other guidance that we've gotten out from the CDC, I think there's lots of confusion just in terms of what you should feel comfortable with versus what you shouldn't feel comfortable doing right now, especially with the spread of the Delta variant. I guess, what's your perspective on this? And I guess, how comfortable should people be going into public settings right now without wearing a mask?
Yeah, they should be much more comfortable than they were a year ago, but that doesn't mean 100% comfort. The virus is certainly still circulating. There are places where Delta is circulating very rapidly in the mountain area and the Mississippi Delta area. So we have to watch that. And if you're living in those areas, you may want to listen to your local public health experts as they're telling you what's going on, because it is going to be a high risk. Even if you're vaccinated, there is the chance that you might have what we call a breakthrough infection. They're incredibly rare, but certainly as anyone weighs the risk, they have to decide for themselves how much risk they think that it is.
Doctor, we are approaching the Olympics, huge event in Japan, and they are sprinting towards their vaccination efforts. We know that they have a shortage of doctors and nurses there. They also have to import all of their vaccines. There's concern that this could be a super spreader event. Can you walk us through those concerns and how you see the situation?
Yeah, that is one of the big concerns. You've got people living in close housing together. They're competing in athletic events. And as you can imagine, that means people are going to be breathing harder, which could expel more of the virus. So those are definitely the possibility for super spreader events. The good thing is it looks like they're not going to allow spectators, which that will help to reduce the transmission if they do start to have any kind of transmission. Hopefully they'll also do some regular testing, similar to what the NBA, the NHL was doing last year to try to limit spread among athletes. Those measures all can work to help prevent the virus from spreading. So they've got good things they can do that we know work. And hopefully they'll use those measures and we won't see a super spreader event.
What's your biggest worry right now at this phase of the pandemic? Because it seems like we had things relatively under control in the U.S. Now, of course, there's fears with the Delta variant, especially among those who have not been vaccinated. But I guess from your perspective, what's your biggest worry as we head into the rest of the summer months and then, of course, into the fall?
The biggest worry would be that the virus might mutate in a way that makes it escape the vaccine. Again, not likely, but that would be something that could lead to lockdowns again. I think, honestly, we're looking really good in terms of the data. The cases are staying low. People are continuing to slowly get vaccinated. We do need that to pick up in order to really get rid of the virus. And hopefully that will happen as the next 6 to 9 months progress. People will become more and more comfortable and we'll be able to hit that 70% target.
Well, I want to ask you now about booster shots. Pfizer is talking up their potential for one. The FDA and the CDC saying maybe not just yet. What kind of work needs to go into, I guess, studying? What kind of studies need to happen before booster shots are really considered and get that EUA authorization?
Well, we really need to get the 12-month data. So we've got the 6-month data from Pfizer and Moderna. We need to see at 12 months, what are the antibodies like in people that were in the clinical trial last fall? We won't have that until September or October, so we really don't know if a booster is necessary. From Pfizer's perspective, it's probably smart to go ahead and start thinking about a vaccine because they'll certainly want to be able to launch it if we need a booster. But there's no data to indicate that we need a booster at this time.
And any update on when we could expect children under the age of 12 to be eligible for the vaccine?
It's probably not going to be until later in the fall. We still don't have the results of the clinical trial, and I think those are due in toward the end of the summer, early fall. So with that one, we probably still have to wait on for a while.